Hello, hello. Let me know where you're joining me from. Say hi to me. How are you? Thank you for joining. Okay. Hello. Where are you joining from? I don't know who this is. Okay, let me get my. Welcome. Thanks for joining. Oh my goodness. I'm so glad to see you. Thank you. It's gonna be interesting today. Hello, where are you joining from, Houston? Let me see. I can't tell who this is, but I'm guessing it's DJ Aziz. Let me see. Welcome, DJ Aziz. If it's you, you know, I can't thank you enough. I'm trying to see those who are joining. Okay. All right. So there we go. Thanks for joining. Let's get right into it. Let's talk about one of the sleep problems that are common. Okay. Thank you for joining. Again, I'm excited to be here. My name is Oluwadaya Deyemo. You can call me Daya, as you see there. Last week we started this interesting topic. It's so many people have talked about, had asked me to talk about sleep problems. A lot of times people are saying, I can't sleep, Dio, I can't sleep. We need to do something about it. Something happened to me. Then we're talking about, okay, sleep problem. But I wanted people to see beyond that, I can't sleep. And we are doing this under the context of increasing mental health awareness and decreasing stigma. We are outrightly shaming stigma and letting people know, hey, there's so many things out there. Who knows? You might even have something you're dealing with. If we don't make it easy for ourselves to for ourselves and for other people to be able to seek help, one way or the other, it comes back to affect us. So anyway, I am here. We're talking about sleep disorders. I introduced the topic last week. This week, I'm focusing on one of the problems. And the one we're focusing on is excessive daytime sleepiness. Yeah. We divided the problems into three major ones. Okay. And the first one is people, you're sleeping too much, sleeping too little, or you're having abnormal behaviors when you're sleeping, or abnormal behaviors related to sleep. But of the three, we are starting with one today, which is the excessive sleepiness. And you'll see, there's some people like I posted earlier, when we say Jonah Olorum, we say Jonah Olorum because of the story of Jonah in the Bible where he slept off and could not be bothered about anything that was going on, even in the midst of storm. And people tag anyone who sleeps too much as Jonah Olorum in my language in Yoruba, which is, you are you comparing you to Jonah sleeping anywhere, anytime. Another way people say is that he can sleep on water. He will sleep anywhere comfortably. And another one is people call those who sleep a lot, they call them lazy. Like, you're always sleeping. You don't know more than sleeping. How are you able to even do anything if you sleep so much? So excessive daytime sleepiness is it's a concerning sleep problem that some people go through. And for purpose of for to make it easy for all of us, I am going to just say briefly under the five major causes of excessive daytime sleepiness. But let's start with what is excessive. Now, some people in our DSM-5, the Diagnostic Statistical Manual, what professionals, or prescribers, what we used to do at diagnosis, one of the things we have for this hypersomnolence, which is people who sleep too much, the first thing is the self report of um, sleeping or taking naps or sleeping uncontrollably. And a lot of times in situations that you don't even want to sleep. But note this is even with you having had about 7 hours of sleep. So you've been able to sleep at night, you've had about 7 hours of sleep, but you wake up and you're still feeling like you need to take naps. Or you have even sometimes more than 9 hours of sleep and you don't feel restored, or you don't feel freshened, you don't feel energized, you still feel like you need more sleep, or you are just not able to control your sleep anywhere that you get to. And to some people, it's almost like, oh, you are so blessed. Those who are looking for sleep will say, oh my goodness, I wish that I will pay you anything to give me some of your sleep. But the thing is, it excessive sleepiness also has its own negative impact. And the problem, one of the issues we have with this is sometimes those who have this excessive sleepiness, excessive daytime sleepiness, don't even see it as a problem. They're like, I mean, let me sleep. Just let me sleep whenever I have to sleep. And their spouse is talking to them and they just sleep off while their spouse is talking to them. Or they don't, or they are they want to study and they can't even stay awake to read a page or two. Or they are at work in a critical, meeting, or doing something very important and they're just so sleepy. And or even safety, when they're driving, or they're not able to stay fully awake to concentrate. So sometimes people don't see it as a problem, but it might be impacting or having a negative impact on different areas of their life, socially, occupationally, with their academics, safety, cognition. They can't remember stuff. They can't even concentrate enough to store memory or to do anything because they're either not fully awake or they still always find that need to sleep. So yeah, it could be very subtle. Sometimes we joke about it. Sometimes we don't pay attention to it. But I'm sure by the time I tell you more about this, you'll see that a lot of people might be having these issues, and they might need someone, a friend, a colleague, a coworker, an employer, an employee, somebody to call their attention to it that, hey, this might really be a problem. What can we do about it? So that's it. Now let's talk about what are the five causes, or why would anybody be excessively sleepy during the day? Well, I'll tell you the five and then we'll start from the first one to tell a little bit more about it. Or wait, let's do this. How about you guess? What are some of the reasons you think people have excessive daytime sleepiness? Tell me what you think. Let me see those who are online. I see some people. What do you think make people sleep excessively? I mean, these things we see it. Let's interact. Let's talk. Let's talk. Tell me, what do you think? I'm really trying to see who. Let me see if I can identify the people watching me. Why do you think people sleep excessively? Sometimes I think, okay, okay. Yes, disorders like narcolepsy. Thank you. Depression. Thank you. Good. Oh, DJ Aziz, I got it right. That was you. Uncle Adepo. Thank you for joining. Okay. Okay. My sister, Satayo Digmitade, we can't wait for your book to come out. We're going to celebrate that book on autism. Yes, so narcolepsy, depression, you're right. You're right. Narcolepsy, depression. But let's do it this way so that it's comprehensive and we're able to, have a better perspective. The first one is, let's talk about quality of sleep. Are people you having enough, the 7 hours that we're talking about, or in the case of those who sleep for 9 hours, we want to talk about the quality of sleep. Are you having enough sleep? Let's talk about the quality, the quantity, the amount of sleep. How many hours of sleep are you really getting? That's another one. Let's talk about shift work. Those who are shift workers, what is going on? When do you work? When do you sleep? And when you're working, if you have to work nights, DJ Aziz work nights most of the time. And I know that for you to get to talk to him, because of the nature of his work, he's awake most of the time in the evening. But is he able to wake up when he needs to do something, to do the things that he needs to do? So we're talking about the shift work syndrome. Then we have substance and medication, and then the other one is the last one will be the brain issues. So that is where narcolepsy will fall under. So let me start with this. The five again. We're talking about the duration of sleep. How long is a person sleeping at night? We're talking about the quality of sleep the person gets when he or she is sleeping. We're talking about the shift work syndrome, when you disturb the natural cycle of sleep, going to bed at night and sleeping in the morning. There's so many professions, that fall into this category. And then we have medication and substances, and the last one is the brain problem, primary issues with the brain itself. So the first one is, which is the most common reason a lot of people are having excessive daytime sleepiness, is because they are not getting enough sleep at night. Excessive daytime sleepiness, and I won't talk much about this first point because it's what we're going to deal with entirely next Saturday. Some people put this on themselves, and some people have trouble. They actually have issues with insomnia. So now, you're not getting enough sleep at night. Some people just don't feel the need to sleep. We know that it's almost like, some people, it's almost like a something to be praised, or it's almost idolized, it's almost celebrated, that, oh, I only sleep 4 hours a day. Oh, you hear about, okay, this business person, if you're going to be an entrepreneur, you can't be sleeping when everybody is work, you can't be sleeping when everybody is sleeping, you have to be up, you have to sleep only 4 hours. Medical students, some people just don't sleep. You have an exam, they're not prioritizing sleep, so they intentionally are not getting enough sleep at night. And it is a big problem, because last week I talked about the importance of sleep. We need sleep for a lot of things, including the brain repairing some of the, doing some repair, and taking away of waste products that is not needed, and including memory consolidation. Lack of sleep has been related to some other issues. I won't go into that, but sleep is really essential for us to function normally. So some people just don't feel the need to sleep, so they're not sleeping. So during the day, when they're supposed to be doing something else, because they have been sleep deprived at night, they are not getting enough sleep. Or, they're setting their alarm to wake up so many times because of something, they're not getting enough sleep. And some people just have insomnia, which is, insomnia. Yeah, okay. Thank you. Quality of shift work syndrome, medication. Okay, I'll come back to that. So the insomnia is the trouble falling asleep, staying asleep, or waking up too early. Some people have that. So if they have that issue with primary issues with sleep during the day, they are sleeping when they're not supposed to sleep. They're sleeping when they don't want to sleep, and sometimes even in socially awkward instances. So that's another one. But I would not go deep into insomnia today, because we're going to focus on lack of sleep next week. Now, going to the second one, which is the quality of sleep. And this is where I will spend most of my the time today, before we will round up shortly. Most of the time, the focus will be on this: not getting quality sleep. And there many things that can impact getting quality sleep. And one of it that I would focus on is when someone has breathing issues, when we have breathing related problems affecting sleep. Another one is restless leg syndrome. People they can't stop moving their legs, and they're just not able to control it. It wakes them up. They feel the need to wake up every time. We have that. But let's focus on the breathing related issues or breathing related sleep issues at night. And we have this one that you probably have heard of, we call sleep apnea. Sleep apnea, when people have, a difficulty breathing well at night, or when they're sleeping, it wakes them up. And there are two types of sleep apnea. There's the obstructive sleep apnea, which there's something physically obstructing the airway. It could be the throat, it could be the tongue is, touching the upper palate, it could be something going on here in the region, and the person is not able to, there's obstruction with the flow of oxygen while the person is sleeping. So that's when all this snoring that people are doing, and some people will say, the person in my language, they say, oh, fuck yeah. Like they stop and they just go with another rhythm or vibe or something. All those things, it's kind of like funny, but it's actually that person at that time is not breathing well, and they're waking up to catch their breath, or they're waking up to the brain is getting the signal that, hey, I'm not getting enough oxygen, and they wake the body up to adjust or to do something so that they're able to maybe start breathing well or increase the airflow. And the body also has its own way of regulating this mechanism. So instead of you falling into that deep sleep, because already when we're sleeping, the brain is working, and it needs oxygen, it needs all that to do what it's supposed to do. So our breathing has already gone down. Our breathing rate at that time is not like it is when we're actively working. So when there's something obstructing the flow of oxygen, it gets down even more. Now the brain has to struggle because the brain needs this oxygen, wakes them up, and then they wake up turning and tossing, snoring and changing gears, like we say, just to get the sleep. So even if they're in bed for 7 hours or 9 hours, they've been awakened by the self-regulating system of the brain in the body so many times that they don't even know. So that's one is like the central sleep apnea. But the one which is the brain is getting the signal and doing what it's supposed to do. But the other one is the obstruction uh, with the airway. And this thing can be corrected. And now, for those this is just a tip, some of the things that professionals or providers, doctors, nurse practitioners that we look out for, the risk factors that we look out for. We can summarize this in what we call stop bang. So, stop bang is the person is snoring, the person is excessively tired most of the time. There's observed stopping of breathing. You see the person, like the wife or the child or a friend, can say, you actually almost literally stopped breathing, and somebody had to wake you up, or the body would just naturally wake up, struggle to wake up to get their brain some oxygen, and then they start working, to get working back. That observe or stop breathing. Then we have elevated blood pressure. Some people, they have high blood pressure because they're having sleep apneas that they're not paying attention to. So every time, even with medication, their blood pressure doesn't seem to be well controlled. We have that going on. So we're looking out for all those things. Then the obesity part, is the BMI more than 35? If the BMI is more than 35, is one of the risk factors. Then age is also a risk factor, like 55 and above. And in some cases, a lot of times postmenopausal women, they also have issue, that issue early. Then gender is more common with men. That's the G there. It's more common with men. And the neck size is the N. If the neck size is certain part, you check people with really, fat, big necks, which is related to obesity and weight and stuff. These things we'll look out for as risk factors. If you have this thing, maybe 3 or 4 of all these things that I counted, stop, snoring, getting tired easily. O is O is you're observed to have to stop sleep, to stop breathing sometimes. Then P, elevated blood pressure. Then the B, the BMI is higher than 35. The neck size for men, I think it's if it's more than 17.5 inches, and for women, if it's more than 16.5 inches. Then gender, more common with men, so it's a risk factor if you're a man. And then with the G there, the gender, I keep forgetting next size. Then age is age is there over 55. We're looking out for these risk factors for obstructive sleep apnea. And it is very, very common in a lot of people. So many people snore. So many people don't sleep well. So many people have people have the central sleep apnea where they're not physically waking up to say, hey, I'm waking up, but the brain is regulating things by itself. So they're waking up, or instead of getting into the deep sleep, they are just back to the light sleep. I talked about N1, N2, N3, and the REM sleep last week. So instead of getting into the deep sleep and to the REM sleep, they're not getting there because the brain has to keep them in the lighter sleep phase so that they don't stop breathing, so that they don't lose that oxygen flow to the brain. But how many people treat this? We just take it for granted. He's snoring, your partner will either leave the room for you, or your partner will just leave the room for you, or you will just sleep somewhere or change where you're sleeping. And there's usually, this issue back and forth. Breathing related problem is one of the factors responsible for excessive daytime sleepiness. When it's untreated, even though you are sleeping, you think you are sleeping for 7 hours or for 9 hours, you wake up feeling tired. You wake up having headaches. You wake up feeling very sluggish. You wake up with fatigue. You wake up and you feel like I need more. You might want to check out if there's something going on there. And if you have at least 3 of the risk factors that I just mentioned, you might want to check in with your doctor to say, hey, you know, could this be an issue, something I need to take care of? You want to do that. Another one is the shift worker syndrome. Things are just off. Nurses, a lot of nurses, a lot of doctors, they're on call. Security officers, engineers, military people. They're at different times, or with a lot of profession, the shift work throws off the sleep pattern. So, and the time that they are not doing their shift work, they still don't have a pattern of sleep. So they sleep whenever, however, because it's their time. And a lot of adults, especially men, because maybe they don't have to take care of children, or maybe they don't have to do some errands, or maybe there's some things they don't have to do, or they're single, they live alone, and you just do whatever you like. So you sleep at your convenience. You sleep when you want. So a lot of times in awkward places, at times that you want to stay awake, you're not able to regulate your sleep, and is impacting your social life, and maybe your productivity and even cognition. A lot of times, how you're thinking, most times. So that is another one. If you are a shift worker and you find yourself sleeping when you do not want to, or excessively, the need to take naps all the time, tiredness, you might have that syndrome. And just some changes will take care of it if there's nothing else. underlining. Then with that, I'll go to substances and medication. These days, we know that first, I mean, let me see this as a provider. A lot of times, well, let me not use a lot of times. I'm seeing more and more adolescents. I'm seeing more and more young adults coming to for assessment, and right away they're telling you that they want medication for something, even without assessment being done. Just last week I had and maybe a 22-year-old or something that was just upset with me because if you have sleep problem, or just saying I'm not sleeping well, or I'm sleeping too much, or I'm tired every time, does not qualify you to have a medication. We need to do a thorough assessment. We need to do thorough history taking. We need to check how, your daily pattern, sleeping pattern, and the things you do. But now everybody just wants a medication. So they come and they're angry if you're trying to assess to see what is going on. So I have to ask some of them to say, do you want to be treated or do you want medication? They're two different things. Seeing a psychiatrist or seeing a doctor does not mean that you would need a medication. You might just need some insight to say, this is what is going on and these are the things we can do to address it. But a lot of people seem to want medication more than anything this time. But anyway, I just want to say medication is not always the solution to everything going on. A thorough history taking, assessment, test, diagnostic test, or screening tools and things like that can lead us to the part so that we're able to make accurate diagnosis, then follow it up with the appropriate treatment. And appropriate treatment is not always medication. That said, I want to say that with medication, we know that there are a lot of people on medication. Even a lot of elderly people are on medication, and they have, even polypharmacy, not just one medication, more than one, more than two. So we have sometimes interactions going on, or sometimes the medication that you have is keeping you awake or making you sleep too much. I know there's some antidepressants that has a higher sleep profile, or sedation profile, and then we have to adjust it, maybe the dosing or the timing, and we'll do stuff like that. So medication is one of the things that cause people to have excessive daytime sleepiness, and one of it that relates to psychiatry is antipsychotics as well. Some people, they're taking antipsychotics that having a high profile for sedation, and they're sleeping a lot. But things like this, that is why we have follow up. That is why we talk about what is going on. That is why we ask about side effects. That's why we talk about all those things, and we make adjustments. But beyond psychiatry, even medical treatments too. Some medical illnesses bring about the need to have to take medications that might make you sleep. So that is where the thorough assessment. Tell me all the medications you're taking. When did you start taking this medication? When did you find yourself sleeping too much? How long has this thing started? Are there days that it's not happening? That, all that. And by the way, most of the sleep disorders and the things we do, we're looking for, is this happening more than 3 times a week? And has it happened for 3 months at least? So with the onset of the symptoms, the onset of the signs that you're telling, we want to know. So more than 3 times a week, or has it been happening for more than 3 months? We're asking that. So if you're saying, oh, I saw my PCP last week, or I saw my doctor last week, or 2 weeks ago, and he started me on this medication, but that medication is just for thyroid, or the medication is just for this, you're like, no, that has nothing to do with anything. Well, I might be giving you another medication. We might be having interaction of medications, that one I'm giving you and the one that the other specialist or your primary care provider is giving you. If you're taking this, then we need to reduce this, because this one is going to make this one to be more to make you more drowsy, or it will make you have more half life of the medication, then we'll just talk about it and we can adjust it. So medication is one, and with it is other substances. There are people taking other drugs, over the counter medication, over the counter, or street drugs, or some other things that they're taking, alcohol, different things that they're taking that can cause daytime sleepiness, that all we have to do is know and make adjustment or stop, or maybe you just have to stop the substance you're taking that is causing the excessive sleepiness. That might not necessarily be medication or related to any treatment. That's one. Now, the one that someone mentioned, my sister's, Mr. Tayo Ipitale, she's talked about narcolepsy, sleep disorder like that. Mm. So now I will talk about brain issues. This is number 5. I'll do a quick recap. We talked about, 5 possible causes. You're not sleeping enough. The quality of sleep is poor. Shift work syndrome. And we talked about medication and substances. And the last one is brain issues. There's just a primary something going on with the brain. One of it is there's one little thing at the back of our brain here that that regulates our awakeness and the sleepiness. So with the awakeness and sleepiness, if something is wrong with that thing, we call it the reticular activating system. At the back there, if something is wrong with it, say a congenital disorder, or say it's supposed to regulate, say, keep you awake when you're supposed to be awake, and at night it shuts off, so melatonin goes up and we're able to start falling asleep when it's dark and we have melatonin coming on. But if it's not working well, say for example congenital disorder, we might have issues with the regulation of sleep, and sometimes we have issues with shortage of some neurotransmitters that the professionals will check the cerebrospinal fluid to see, okay, do we have an issue with too much or too little of this in the system, and work on that. But another one is this narcolepsy, that we really don't know the cause of narcolepsy. But what are the issues with narcolepsy is this is when someone is unable to control their sleep. They're just unable to control the sleep. It is genetic. It is a lifelong issue. I think about 1 in 2,000 people have this disorder, and the disorder has things that comes with it. One of it is that people usually talk about is cataplexy, which is just the body muscles just shut down abruptly. So we can have narcolepsy with cataplexy, or we have it without it. The muscles of the body will just go limp suddenly. Cataplexy is usually triggered by a strong emotion, like maybe laughing or laughing or crying or just excitement, and it happens like that. But in this case, it's related to narcolepsy, which is the brain is just not able to regulate anything, and the sleep attack will happen. This person will fall asleep, will sleep and get into the REM sleep within 5 minutes. So imagine somebody falling asleep the way so I'm assuming I don't have narcolepsy. So the way I should feel if I haven't slept for 48 hours is the way people with narcolepsy would feel, and they fall into deep sleep within 5 minutes. And when they fall into the sleep within 5 minutes, last week when I talked about the N1, N2, and N3, then REM, the cycle is usually about 90 minutes. So what is supposed to take a normal person or someone without narcolepsy 1 hour to achieve, they do it in 5 minutes. and it is just uncontrollable. They can't control it. And we call this like sleep attacks. When they have it and they fall into that sleep like that, catalepsy, which is maybe they're holding something or they're doing something and what they're holding will just drop and they start snoring or they just go into deep sleep almost immediately. It's a big problem. Another thing that happens with this is with the sleep paralysis is they can have hallucinations. Like they can vividly maybe see themselves doing something or see something happening that is not actually happening as they're doing it, that it will be so vivid, almost so real to them when it's just happening or after or towards the end of it. It will be really, really disturbing. Really disturbing. And with narcolepsy comes serious safety issues. People with that have untreated narcolepsy shouldn't be driving because it's a public safety issue for them, for people and even for them. And imagine if somebody is living like that. I had this girl, as a teenager, a high school girl. I watched a TED talk recently talking about how she's just not able to stay awake. And when it started, is people started calling her lazy. She started failing. She would sleep when she has a test. She would sleep anywhere and anytime, and she just couldn't control it. She was like, one of the happiest days for her was the day she actually had a name for what was happening to her. And she started, treatment now that she knows what was going on with her because it could be really disturbing. So people just see it as this person has a problem. What is you hear people with this kind of problem saying it's like I'm sleeping my life away. It's like I can't remember anything. I can't function. Sleep is taking over my life and it's so disturbing. What can I do? It's so disturbing. And people around them will just say you just need to know that this life is more than sleep. You need to go and get it together. And instead of seeking professional help, most time people want to start taking medication. They go and consult Dr. Google and see this is, what we take for this, and they're looking for the medication. I've had an instance where someone actually, a patient that's been treated for another diagnosis, was coming to start complaining of having issues. Um, and I was putting everything together. Okay, when did that start? But it couldn't give me the answers. But it was asking for a specific medication. He was just asking for this medication because I went on Google and I can see this is the medication that will help me, and I just want you to prescribe it. Let's try it. Like something is not adding up here. By the time, like, well, let's revisit that on next visit. We can do watchful waiting. Like I said, we don't have to start medication all the time. So I said, let's do watchful waiting. Let's see. Because sometimes, maybe something just changed in your pattern, or maybe something is going on. Are you sleeping well? We're usually asking that. He just wanted the medication. Well, thank God. On the next visit, he had a change of heart. And he was like, you know what, really, I was just trying to get this medication for my girlfriend. Are you serious? Say yes. You know, she doesn't have insurance. She doesn't want to see a provider for psychiatric needs. But we went on Google and we find out this is what's going on with her. And this is the medication. So he was trying to achieve that. His treatment and his girlfriend's treatment with my visit of him, with him. So without thorough assessment and knowing just not dishing out medications all the time, we can miss some important issues going on. So to my point, some people want to self-medicate instead of seeking appropriate treatment. So if you're sleeping, and yes, I was going to share this with everyone, that I think if you know anybody that's having issues with excessive daytime sleepiness, or you think that, I think I sleep too much, and it's not, I'm trying, I don't necessarily have to sleep this much. I'm getting enough sleep. I'm having the need to take a nap all the time. And when I say that I want to take a nap, by the way, any sleep that is, if it's more than 20 minutes, is no longer a nap. Okay, you want to take a nap and you wake up, you've slept 3 hours, and you wake up again, and within hours you feel that you have to sleep again. If you think you're having that issue, I want you to go and use this Epworth sleepiness scale. We can all take this because, like I'm saying, assessment is one of the very important things we have to do. So, in tackling this issue, let's all take the sleepiness scale, see where you fall. Okay, this is just a screening tool to see, do I need to see somebody for sleepiness? Share it with a friend, or somebody that you think this might help, or you just take it and see. Now, if you're like at a 6, you're good. We're good. It's kind of normal, because there are times that maybe life or changes, or some change in our routine can bring about that. But you're good. Take the assessment. If you have more than 10, if you score more than 10, you might want to discuss with your doctor. It is not a diagnostic tool, it is just a screening tool to say there's something happening. How about I get more into this and see what the problem is? That's what that means. If it's more than 10, talk to someone. Then we'll do assessments. Then they do thorough examination, they do thorough evaluation, they take history, all the things that they need to do, then they will do it at that time. Let's take the assessment. It's a self-assessment. It's one of the things that we do to diagnose it, excessive daytime sleepiness. Now, another thing is, you know there's a problem, do something. Another one is, you don't think it's a problem, but your wife is complaining, or your spouse is complaining, or your partner says, hey, every time I'm talking to you, you just sleep off. When we have guests in the house, you don't care, you just sleep off. Okay, we went to bed last night, you woke up, now you're watching TV, you're sleeping again. What is it? I'm not even getting enough time with you. Is somebody saying that? Or are your colleagues, or your teammates, or team members, or your employer or employee, or siblings, or parents, or teacher, or somebody saying, hey, you seem to be sleeping a little bit too much. I think you need to do something about it. In the case of teenagers, you want to check when are they getting off their phones, in the middle of the night, how much chats and group stuff are they having? Things like that, you want to watch it. So it's not, the sleepiness might actually be caused by one of these 5 things that I said, but we need to look into it, because we need sleep. Our brain needs sleep, for now, for future, you know. And when we talk about insomnia next week, I'll tell you how insomnia ties into dementia, and why it is important for us to prioritize our sleep and get adequate sleep. Throughout the course of the week, I'll be putting posters on, what the Sleep Foundation, National Sleep Foundation, their recommendation for sleep, the sleep chart. People argue, I don't need so much sleep to function. And some people say, hey, I need so much sleep to function. But what is normal? What is the normal range? But beyond the normal range, is your sleepiness negatively affecting, or is it causing any impairment in your social relationship, in an occupational space, or with academics, or even with daily activities? Are you sleeping too much? You want to look into this. You want to look into this. Now tell me, okay. Oh, thank you so much. I see somebody has been outlining this for me, and I can guess this is my sister. She is always good with outlining the things that I'm making. Yes, breathing problem like sleep apnea. Sleep apnea is so common. Yesterday was World Obesity Day, and I was privileged to, I mean, just lucky enough to find a live show that they had with Olori, with the Olori, on Facebook yesterday, and they had a doc. I didn't start with them, but I got a lot of useful information on how to stay active, how to be intentional about our weight, how to be intentional about our daily activities, what we're eating, and the importance of staying healthy. Obesity is one of the risk factors for, sleep apnea. This sleep apnea, the issue, the obstruction of breathing while we sleep, has to be looked into. So yes, all of that it has to be looked into. So please, if you know anyone, maybe a colleague, a friend, a spouse, a lot of times it is a spouse that knows what is going on, particularly with the snoring. We take snoring so lightly, but it really shouldn't be. So a lot of people that believe they are sleeping are not getting restorative sleep. The brain is either regulating it itself while they're sleeping, or they're actually physically waking up to catch their breath and to sleep. So let me round up by just saying, how do we tackle this? Tackling it depends on one thing first: accurate diagnosis. And with accurate diagnosis, you need to start with you being true to yourself. It has to start with us not stigmatizing anybody seeing a professional. If you have to see a neurologist, if you have to see a psychiatrist, if you have to do any of these things, without you already having in your mind the medication you want, but with you going there to find out what is going on and get appropriate treatment. Ambien, Lexotan, what else? Valium, Vazopad, Clonopin, all those things that people come to want to do, help them with sleep, or give me a stimulant, or give me, a medication to keep me on. I want Adderall. I want this to stay up. No, it is important for us to actually have it treated. So tackling it, we need accurate diagnosis. Accurate diagnosis starts with you being real to yourself, being truthful to what is going on, and seeking help. And the other thing is, have a sleep diary. A sleep diary, this is when you are start if you're going to see a doctor or you think this applies to me, start get a diary. Start jotting and noting the time you're going to bed, the time you're sleeping. Are you waking up at night with something going on? Is your leg always shaking? Do you always feel the need to get up to move your legs? Do you have tingling sensations? You just start keeping a diary of what is going on. Having like a 2 hour, two weeks of sleep diary would help give the provider or whoever would do the assessment a better insight into the pattern that you're going through. So, and when they find out what is happening, if it's sleep apnea, either obstructive sleep apnea or central sleep apnea, you're going to get treatment. CPAP has saved a lot of people a lot of stress. I can tell you that I've had patients that come with depression, and they're talking about, I'm so depressed. They're depressed. They are unhappy, depressed, worried because they're not getting enough sleep, or maybe they're sleeping too much during the day. And I'm like, okay, I think you should see a neurologist. I think you should or see your primary care physician, your doctor, to do a sleep study first. And it turned out that I can remember this woman in the nursing home. I'll not mention. I can remember her right now, right now. The day she was telling me, "Oh my God, Dio, thank you for just saying that. I've been sleeping much better. I've been feeling well rested since I started using my CPAP." It took a while to get it because of insurance issue and stuff, but we didn't have to keep going going up on antidepressant medication, because when she addressed the sleep issue and she was waking up feeling rested and being able to participate in activities and stuff, it took care of a lot of stuff and she got better from there. And actually, before I stopped going to that facility, we were already on the part of weaning her off because she was doing therapy as well. So she was sleeping better, she was doing therapy, and we were going down on the medication. Okay, so sleep apnea needs to be addressed. And if you know anyone who is obese, they're on the big side, their body mass index, you can check body mass index use Google for that. Calculate your body mass index. Are you on the obese side? Do you have to do something? Just look into that. And once we get that right, then the last resort the last resort is medication if we have to, medication if it's needed. A provider would not deny you medication because they just don't want to give you medication. We just have to put all these things together to tackle it. Tackle it, tackle sleep, excessive daytime sleepiness. So now I want to ask you, if you have any questions, please ask in the comment. And I will end by saying thank you. Margaret Thatcher only she boasted she only slept 4 hours a night. We see a lot of things like that happen. People saying it, and it's almost like if you get 7 hours, like, oh my God, you're sleeping your life away. You can do a lot more. Entrepreneurs, you know, they have stuff going on. Okay, let me see the names. Abdullah Bukola, thank you for joining. Yes, and maybe you were able to join us live. Oh, Dr. Ruth, Princess, thank you so much. You see, look at her profile picture. She is a princess, and I just love it. I know a princess. Well done. Discuss sleep hygiene today. Okay, okay. She also discussed sleep hygiene today. If you can find her, page, Princess Ruth on Facebook. She discussed sleep hygiene today. It is very important. We will talk more about sleep hygiene in 2 weeks' time after when we're talking about abnormal sleep behavior. So, a step at a time, we talked about the general overview of sleep and sleep wake disorders last week. We divided the problems into three: sleeping too much, which is what we're doing today. We talk about sleeping too little, not getting enough sleep. We'll talk about that tomorrow. I mean, next week, Saturday. And then the last one is going to be abnormal sleep behaviors. And then we'll talk about treatment and tips on getting healthy sleep on the last one. So thank you for joining. Let me see. My Uncle Ladepo, I know that you are there. I will quickly check Facebook. We'll make sure that I acknowledge everyone. Fatima to short there. Oh my God. You need to talk to the adolescent. She is the adolescent lady. JP Lawson, thank you for joining. Oh my God, Dr. Liz, Dr. Uchi, she joined. Thank you so much for joining. DJ Aziz, I can't thank you enough. So, and if you're watching a replay, please put replay. Let me know that you watch the replay and add a comment, a question, a suggestion, or any other thing you think would benefit us. Add to it. Thank you all so much for joining. I will be here next week and we'll be talking about insomnia. Today, we talk about hypersomnia. Next week, insomnia. Make it a date with me. Okay? And I will leave with my regular. My mental health matters. What about yours? Catch you.